You are taking vitamin D every day, but without one thing, you are absorbing almost none of it. I am not talking about the dose, not talking about the brand. I am talking about a mistake that makes the entire pill pointless. I had a patient, 31 years old, took vitamin D daily for 2 years straight. She came in exhausted, with bone pain and frequent muscle weakness. Her blood test showed a vitamin D level of 14, severely deficient, despite taking a supplement every single day. When I asked how she took it, she said, "Every morning, on an empty stomach." That habit had quietly wasted 2 years of supplementation. If you take vitamin D the same way, stay with me. This one detail could explain why nothing has changed for you either. If you are new to this channel, I am Dr. Ryan Carter. I have spent 7 years working in emergency medicine. I started this channel because the healthcare system never has enough time to tell you what I am about to tell you right now. So let us get into it. Her name was Olivia, a teacher, 31 years old. She read about vitamin D deficiency online and started supplementing immediately. Every morning she took her vitamin D pill with black coffee before breakfast. She assumed consistency was all that mattered. For 2 years, she never missed a single day. Olivia trusted that daily consistency would eventually fix her deficiency. That assumption left her vitamin D level barely changed after 2 years. When she came to my emergency room with severe fatigue, we retested her levels. Still critically low, despite 2 years of daily supplementation. I asked her one specific question that changed everything. Did she take it with food containing fat? She said no. She had no idea that mattered at all. Vitamin D is fat-soluble, meaning it requires dietary fat to be absorbed properly. Without fat present, most of the vitamin passes through your digestive system unused. The system failed Olivia in a quiet, easily overlooked way. Her doctor prescribed the supplement, but never explained how to take it correctly. Nobody mentioned that timing and food pairing mattered just as much as the dose itself. Olivia is not unique. I see this mistake constantly among my patients, and it is the single most common reason supplementation fails completely. Here is exactly what happens inside your body. Think of vitamin D like cargo that needs a delivery truck to move. That delivery truck is dietary fat, found in foods like avocado, eggs, or olive oil. Without fat present, vitamin D has no transport system to enter your bloodstream. When you take vitamin D on an empty stomach, much of it stays trapped in your gut. It then passes through your digestive system largely unabsorbed. Your body does this. That causes most of the dose to go to waste. And if you repeat that every day for 2 years, the result is persistent deficiency despite consistent supplementation. Here is the mechanism in more detail. Vitamin D needs bile, a digestive fluid released specifically when you eat fat, to be absorbed. Without that release, the vitamin cannot cross into your bloodstream efficiently. A study published in the Journal of the Academy of Nutrition and Dietetics tested this directly. Researchers found participants absorbed 32% more vitamin D when taken with a fat-containing meal. 32% more. From one simple timing change, nothing else. This explains why so many people supplement for months with little to no improvement. This is not about the supplement quality, it is about how and when you take it. And most supplement labels never mention this critical detail. I want to share something that surprised me personally. I took vitamin D for over a year, usually with my morning coffee, no food. My level tested at 22, still below the recommended range of 30. I assumed I just needed a higher dose. Instead, I simply moved my vitamin D to dinner, alongside salmon or avocado. Same dose, same supplement, different timing entirely. 3 months later, my level rose to 41. No dose change, no new supplement purchased. Olivia, my 31-year-old patient, made the same single adjustment. Within 4 months, her level rose from 14 to 38. Her fatigue and bone pain resolved almost completely. She tells me she wishes someone had mentioned this years earlier. So here is exactly what I would do starting today. Take vitamin D with your largest meal of the day, not on an empty stomach. Dietary fat in that meal helps your body absorb it properly. Free, no equipment, just shift the timing of your existing supplement. Pair it specifically with a fat-containing food, like eggs, nuts, or olive oil. Even a small amount of fat significantly improves absorption compared to none at all. What I would do is take it alongside dinner, when most meals contain some fat. Avoid taking it with black coffee or tea alone, since neither contains fat. This common pairing is exactly why many people see no improvement over time. Switching to a fat-containing meal costs nothing extra beyond your normal eating habits. Get retested after 3 months, not just once at the start. This confirms whether the timing change is actually working for your body specifically. Most labs offer this test as part of routine annual blood work. Consider your individual dose with a doctor, since needs vary based on starting levels. What the research shows is timing matters as much as dosage itself. This combination, dose and timing together, makes the real difference. One simple rule protects your supplement investment more than anything else. Never take a fat-soluble vitamin without fat present in that same meal. It costs nothing extra. It just requires pairing it correctly, every single time. I really hope this helped you. If it did, please like this video and share it with someone who needs to hear this. Subscribe to the channel and hit the bell icon so you never miss a video. Before you go, if there is a topic you would like me to cover, leave a comment below. I read your comments and use your suggestions to decide what content to create next. Let me know what video you would like to see, and it might be featured in my next upload. It is completely free, and it helps this channel reach more people who need this information. I will see you in the next one.